psychiatrist. Then we have Dr. Anila. Then we have Dr. Anila, who is our dermatologist. Then we have Dr. Arifa, she's our general practitioner. And then we have Dr. Wala, who's a general practitioner. So I would like to say some words before we start to the programs officially. In healthcare, we witness firsthand the resilience, dedication, and compassion of women, whether as doctors, nurses, caregivers, researchers, or patients advocating for their well-being. Today, let us recognize and appreciate the incredible women who make a difference in this field every single day. Let us commit to breaking down barriers, supporting each other, and fostering an environment where every woman, whether a caregiver or a patient, receives the respect, the opportunities, and the care she deserves. So wishing each one of you present here a very happy Women's Day. I would like to start this program calling upon Dr. Tisha to say a few words to us regarding one of the most important segment of, I think, what every woman is facing today is mental illness. It's not literally mental illness, but it's something like everyone fears to bring it out, or there is a hindrance to proceed to a psychiatrist, feeling like what will society say, or something like that. So first of all, I would like to welcome Dr. Tisha, please.
Thank you, Dr. Rania. Good morning, everyone. I am Dr. Tisha. First of all, happy International Women's Day to one and all. So today we will be discussing about like what is mental health. I'm directly going to the topic. So what is mental health, why it is important, and a few things about how to manage stress in a better way, and then about how to take care of our mental health at workplace. So what is mental health? We all have both physical and mental health. We all know a lot about our physical health, right? But we talk a lot about our physical health. We do a lot of exercise, diet, but we hardly talk about our mental health. So mental health is about our psychological, social, and emotional well-being. It affects how we think, we act, and we behave. Okay. And according to World Health Organization, mental health is defined as a state of well-being in which an individual realizes his or her potential and can cope to daily stresses of life and can work productively and can contribute to his or her community. This is the definition of mental health according to WHO. Now, as I already mentioned, mental health is as important as our physical health, but most of the time we don't care about our mental health, or we don't talk about, or we hardly talk about our mental health. But our mind and body is connected. What affects one will definitely affect the other. So in order to be fit and healthy, we should take care of both our physical and mental health. Now, why is mental health important? According to World Health Organization, 1 in 8 persons live with a mental disorder, and there are a lot of psychiatric disorders like depression, anxiety, mood disorder, then addictions, then behavioral issues. Lot of psychiatric disorders are there, but because of lack of stigma and awareness, people are not taking effective care. Now, like I already mentioned, like physical and mental health both are connected, so we should take care of both our physical and mental health in order to stay fit and healthy. Now, we all have small feelings like sadness, grumpy, then happy, anger issues, all these in our day-to-day life, right? But if any of these feelings are there for a long time, and when it starts affecting our day-to-day activities, then it can affect our mental health. So coming to mental health of women, so especially certain psychiatric disorders like anxiety, depression, and then post-traumatic stress disorders and certain other psychosocial disorders are very common in women, especially because of these hormonal changes. So women go through a lot of these emotional problems during menarche, perinatal, and menopause. During menarche, women can, people can have the symptoms like premenstrual disorder, then premenstrual dysphoric disorder, that is higher form of PMS. And next, perinatal mental health. During this related to pregnancy period, we can have disorders like depression, anxiety, psychosis, postpartum blues. Postpartum blues are very common. That is that we can find in almost 70% of people, but within few days it will go. But depression, anxiety, psychosis, this we need to take professional help. Next is menopause, menopausal mental health. Like during menopause, that perimenopause period or after menopause, women can have a lot of psychiatric issues like depression, anxiety, lot of mood swings and all. So all these are because of the hormonal changes. So these disorders are specific to like depression, anxiety. These are very common in women compared to men. Now coming to stress and stress management. So what is stress? Anything, any inputs from the audience? Okay. So stress is like when we are going through a difficult situation, the psychological and the physical symptoms that we go through when we are going through a difficult situation. Like when things are going without like out of our control, or when we are going through any specific stressors, then our body and mind react in a specific way. That is stress. So the only person without stress is a dead person. Now when we are going through stress, we can have these kind of symptoms like tension, tiredness, feeling exhausted, then depression, anxious, anger issues. Now coming to stressors. Stressors means the things that can cause stress. So there are two kind of stressors, like external stress and internal stressors. So external stressors include like any issues, like any relationship issue or any health issue or financial issue, then extreme climatic conditions. So these are external stressors. Then coming to internal stressors include any infection or any our own faulty way of thinking or negative thoughts, then anxiety, depression, all these are negative stressors. So whether it's external or internal stressor, when stress comes, what is happening to our body, now we will see. So we all know that our brain is controlling all our organs, right? So our brain has a lot of chemicals like dopamine, serotonin, adrenaline. So when there is a stress or when there is a difficult situation, there will be an increase of this chemical in our body. And when this increased level of chemical goes to our body organs, it will start showing symptoms like palpitation. Palpitation means increase in heart rate, shortness of breath, breathing difficulty, chest pain, then gas issue, burping, bloating, numbness, aches and pain, all these symptoms. So when the stress is removed, then all the chemical level will come down and our mind and body will go back to rest. So this is the normal thing that is happening in our body when we go through stress. So first I told you, like first is adrenaline rush, that is increase because of increase in chemical level. Then first stage is alarm stage, that is initial fear or anger. Next is resistance stage, that is body repairs the damage caused by stress. And third stage is exhaustion stage, that is if stress is there for a long time, then it will start affecting our both physical and mental health. So is stress good or bad? Bad? Yeah, both. So a mild level of stress is good actually, because it will improve our performance. That is eustress, okay? Because since we have a stress called target, or since children have a stress called exam, that's why they are performing well. Okay, if you don't have targets, like whether we will complete our this one, no, right? It's very unlikely. So a mild level of stress or anxiety is good. It will improve our performance. But if stress is there for a long time, then it can affect our, then that is bad. That is distress. So people are different. Or people are having different personalities. So how they cope to stressful situation also varies from person to person. And that also, the same person, how they react to a stressful situation also varies from time to time. So this already we discussed. Now coming to how we can identify that we have stress. We will have a set of symptoms Like we can have physical symptoms, like already I mentioned, palpitation, that is increase in heart rate, sweating, excessive sweating, cold extremities, then feeling tired, sometimes giddiness, vomiting sensation, heaviness of chest, something like some foreign body sensation in the throat. And then behavioral symptoms like procrastination, that is delaying things, then restlessness, then avoiding others, lack of self-care, substance use, then emotional things like crying spells, irritability, then anger issues, frustration, then cognitive symptoms like negative self-talk, then confusion, poor concentration, attention. So these are some of the symptoms of stress. Okay, so stress can affect both our mind and body. Now, stress can cause other like disorders like migraine, hypertension, sleep disorders, chronic fatigue, then depression, GERD, then lot of eating disorders, allergies. So stress can cause these kind of symptoms also. Now coming to stress management. So as I already mentioned, a stress-free life is not possible. What we can do is to manage stress or cope to stressful situation in a better way. So what we usually do is when we have a problem, we keep on thinking about the problem, right? So what we have to do is we have to think about solution, like different ways of solution. So first is reframing. That is, it will not change the external reality. The reframing is we will think in a different way so that we won't feel that much stressful. And second is focus on the positives and strength. Normally, when we are in stress, lot of negative thoughts will come to our mind, and we keep on thinking about these negative thoughts. So finally, what will happen? We will start having physical symptoms. So during this phase, what you have to do is you have to think, like keep focus on what all positives that you are having in your life. You all have good, like a lot of blessings in your life, right? So you can write all the blessings in a paper, and you can think about all those things. And next is assertiveness. You should learn to say no to things that you are not comfortable. Okay, so lack of assertiveness shows lack of confidence actually. So in workplace and working women, most of the women are facing, they are having a lot of stress because of lack of assertiveness. And next is getting organized. That is, lack of organization also can cause a lot of stress. Like make a to-do list. On the previous day itself, make a to-do list. In that, the most important thing, you keep it as the first thing to do in the day, the beginning of the day. Because in the beginning of the day, our brain will be fresh. And the least priority thing you can keep as the end of the to-do list so that our brain will be tired. The next is, in our busy schedule, usually we won't spend time for ourselves, right? Okay, so what you have to do is, we all have a lot of hobbies or likes and dislikes. So you should spend some time, at least 10 to 15 minutes for the things that you love to do. And next is, like stop worrying about the things that we cannot change. Like we cannot change our past. We cannot change, and future is also not in our hands. So if we keep on thinking about our past and future, then that will make us more anxious. So from past, what we can do is we can learn experience, whatever, learn from that, from our past experience. And future, okay, short-term plans we can do, but planning for 5 years, 10 years, that all, and if it will not go according to our plan, then we will get anxious. So when you plan, what you have to do? You have to do realistic plans. That is also very, very important. And next is like lifestyle changes. Getting adequate sleep is very, very important. Like 7 to 8 hours of continuous sleep is very important. That is, I already mentioned our brain is controlling our organs. So brain is getting rest when we are sleeping. If you are not getting proper sleep, it will gradually affect our memory, for concentration, mood issues, mood changes and all. Next is regular exercise. At least 30 to 40 minutes of regular exercise. You can do any kind of exercise. Because when we exercise, our stress level will come down and happy hormones are secreted. Then having a balanced diet, and never ever skip your breakfast. Have a balanced, healthy breakfast. Reduce alcohol and caffeine use, and drink adequate water also, because dehydration can result in the release of cortisol, that is a stress hormone. Next is listen to calm, soft music, and you can do journaling. Journaling is like in a piece of paper or book, you can write all the negative thoughts, all the worries that you are having. After writing it down, don't read it. You can tear it away or throw it away. In this way, we can expel our negative emotions. Then you can do yoga, meditation, deep breathing exercise, progressive muscle relaxation techniques. All these relaxation techniques you can do. So these are some of the stress management techniques. Now coming to mental health at workplace. So this is also very, very important, right? We all are working women. So first is work-life balance is very important. So we should keep boundary between our personal life and work. And next is when things are not going like as we planned, be kind to yourself. And we should provide support to our employees and have a healthy communication between colleagues is also very, very important. Keep boundary in your workplace. And next is open communication and reduce stigma. If you feel that any of your colleagues or you are going through any crisis or any situation, open up. Okay, if you feel, then take professional help. Then be more assertive, as I told. Then avoid overwork. That is also very, very important. And learn to say no to the things that you cannot do. And take breaks and eliminate toxicity. And you can do leisure activities in between, or like these kind of talks, or you can plan one-day trip with your colleagues and all. And then avoid harmful habits, like I mentioned, this smoking, alcohol, excessive caffeine use. Then work smartly. So like I mentioned, a stress-free life. So today's take-home message is stress-free life is not possible. Irrespective of age, gender, we all have stress in our day-to-day life. So what we can do is to manage stress in a better way, especially in women. When we go through each phases of life, we can have certain disorders because of these hormonal changes. So if we include healthy lifestyle and if we practice these things, like we can manage stress or all the psychiatric issues to a level. And if you feel that things are going out of control, even after doing all these things, you are not getting proper sleep, or once it is affecting your professional life, personal life, family life, then you should take professional help. That is very, very important. Okay, thank you.
Thank you so much, Dr. Tisha. I hope you all took the important points, what she wanted to say. And like she mentioned, mental stress is very important for each one of us, irrespective of what role you play, even if you're a stay-at-home mom or even if you're a working mother. I think mental stress plays a huge role in your life. Now next, for all of you gorgeous women gathered here and online too, we have Dr. Anila, who is our expert dermatologist specialist. She will give you more tips on you gorgeous women to look even more gorgeous. So welcoming Dr. Anila on the stage. Please join us, ma'am.
Why? Which is the largest organ in our body? It is the skin. And which is the first protector of our skin? When you go out, on skin, impact of lifestyle, skin cancer and photo-aging, and skincare routine, psychodermatology or skin and mind. Hormonal changes and skin. Actually, a woman's life is a roller coaster ride of hormones throughout. It starts from puberty, then comes menstrual cycle, then pregnancy, and lastly menopause. Each stage has its own skin health issues. So it starts with the puberty. So what is the most common puberty skin health issue? Acne. So we all have some teenage boys or girls in our home. Most of them will have at least like a few pimples, not like a very severe acne. And here comes the question whether you need to treat acne or not. Because most of the time patients come to the hospital and there is always this contrary. The child wants to treat acne but the parents doesn't want to treat acne. Because parents believe that this is a normal hormonal change and it doesn't require a treatment. So why do we need to treat acne? Basically, acne usually comes in the teenage and that is the same age that you emotionally and mentally grows. And sometimes severe acne can affect the mental health and emotional health of the child. And most of the acne results in scarring and pigmentation. And the treatment of this scar and pigmentation is very difficult compared to the treatment of acne. Then about the pregnancy. All of us have suffered some kind of pigmentary changes in pregnancy, and most importantly melasma, which is otherwise called mask of pregnancy. Sometimes it recovers after pregnancy or sometimes it can persist even after. As you can see in the picture, excessive nail pattern hair growth, skin discoloration, especially on the neck, underarms and groin, and there will be hair loss from the scalp and increased hair growth on the face. If you have any of these symptoms, you should seek the help of dermatologist and a gynecologist simultaneously. Then impact of lifestyle in skin health. And here I emphasize on low glycemic index food and anti-inflammatory diet. That means a diet which is with less processed foods and more of like vegetables, fruits, meats, cereals. You can eat all with good proportion. Hydration is also very important to maintain the skin, moisturization and elasticity. Then what about smoking and alcohol? All of us are very concerned about aging, right? So, do you think smoking and alcohol can accelerate aging? Yes, if you compare a man or a woman who is a chronic smoker in their 40s and you compare them with a normal person, and non-smoker at their 40s, then you can obviously make all the changes. Because smoking and alcohol always increases the inflammatory mediators in the body and and that can accelerate the aging process. What is photoaging and skin cancer? In this picture, you can clearly see what is photoaging. These are some changes, physical and chemical changes in the skin that results in excessive wrinkle, fine lines, pigmentation, and some other growths like media, or even it can lead to skin cancer. And what about skin cancer? Like in any other cancer, the key of management of cancer is early detection and treatment. So all of us should do a self-examination. That is very important. What is ugly sign in skin cancer? That in that picture you can see that person has a lot of skin markings, but the one in the middle which is slightly different from the other. So you should examine your skin, and if you have a lot of marks and if some of it is different from the other, you should consult the doctor. Similarly, if you have a lesion for a very long time on your skin, but suddenly you observe changes like itching or bleeding or crusting, that warrants clinical attention. Then comes skincare routine. Like all of us have at least some skincare routine, right? And most of the time I get a lot of doubts about skincare routine. So, what is the first step in skincare routine? It is the identification of your skin type, because it is different for different skin type. It could be dry, normal, oily, combination, or sensitive. And who is the best person to identify your skin type? It's actually not the doctor, it is you, yourself. Because you might come to the doctor after your work, or immediately after you wash your face, or maybe after a long day. Then the doctor cannot assess if it is a dry skin or oily skin or a sensitive skin. That you should assess yourself what is your skin type. Then what about sensitive skin type? Sensitivity means sometimes your skin feels burning, itching, or there has some textural changes. This is the sensitive skin type. And steps of skincare routine, like all of us are working women with a busy schedule. So let's make it very simple. So the basic skincare routine involves only these 3 steps: cleanser, moisturizer, and sunscreen. So if you are familiar with this basic routine, and if your skin is okay with this basic routine, you can go with advanced, because you might have doubts regarding toners, spot treatment, antioxidant serums, or eye cream. This all comes after you are familiar with the basic routine. So in the cleanser also, you have to select your cleanser according to your skin type. If you have dry skin, you should go for a vegetarian or hydrating cleanser. If you have oil or acne skin, you go with the salicylic or hyaluronic acid or hydroxychloroquine. And according to what your disease, gently rub with your fingertips and make sure that you show all your enhancement on your face. Next step is moisturization. For moisturization, you need to find the products that is suitable for your skin type. Moisturizer, what is the role of moisturization? It's actually giving moisturization and also sealing the moisture and naturalism in your skin. So for dry skin, you can go with the liquid cream moisturizer, and your oily skin, you should lightly or a gel-based moisturizer. And the last step in a day routine is sunscreen. So when you purchase the sunscreen, what is the important thing that you should look? It is the SPF. You should go with at least minimum 30 SPF to get an adequate sun coverage. And in an ideal situation, you have to apply every 2 hours. Some companies claim that it lasts for 24 hours or 12 hours, but when you are exposed to direct sun, it is ideal to do every 2 hours. You might be familiar with the term mineral and chemical sunscreen. If you ask me which one is safe, both are safe. And if you ask me which one is safer, mineral is slightly safer than chemical. So what is the mineral sunscreen? It is actually a physical barrier. Same like when you hold an umbrella to protect your skin. So actually it reflects the sunlight. It will not absorb. You can see the players like cricket players and all with a lot of sunscreen, and it leaves a white cast. So mainly mineral sunscreen leaves a white cast. And most of the sunscreen that we purchase from shops are actually chemical sunscreen. And and it requires at least 15 minutes on your skin with adequate sun protection. So if you have an expected sun exposure, you have to apply your sunscreen at least 15 to 20 minutes prior to it. And what about the quantity? It is at least a half a teaspoon or 2 finger length for your entire face and neck. Then lastly, what about the serum? That most of people has doubts about the serum because you can get a number of serums in the market. So actually, this is advanced skincare routine. If you are okay with the basic only, you should have to go for the advanced routine and now select the product according to your concerns. Depending on your skin type, if it is acne prone or if you have some pigmentation or if your concern is anti-aging, you have to choose accordingly. And these antioxidant serums are basically free radical scavengers that in day-to-day life we are exposed to sun, dust, and there are a lot of chemical processes in our body, and it generates a lot of free radicals that will lead to pigmentation, aging, sagging, a lot of things in the skin. So in skincare routine, you can include either vitamin C or niacinamide or retinol or other glycolic acid, and you should be very careful when you apply those serums. Some serums you can apply only in the night. They include retinol, alpha hydroxyacid and beta hydroxyacid. Other serums you can either apply in the morning or in the night. And lastly, what is psychodermatology? It is actually the connection between the mind and the skin. Mind has connection with every part of the body as with the skin also. Psychological factors like stress, anxiety and depression can influence your skin diseases. Sometimes we wonder that this skin condition has happened to me when I am at the peak of my stress. Because some skin conditions are directly related with the stress, anxiety or mind situations. So in these situations, we need to approach it differently. And this holistic approach highlights the powerful link between mind and skin health. And that is, we promote healing from inside out. Thank you.
Thank you so much. Now, one of the most important thing when it comes to a woman's health, I think the first thing that comes to our mind as women is gynecologists. So here I'm introducing two of our expert gynecologists to this panel. One is Dr. Hema, who has several years of expertise in this field, and next is Dr. Jean. She has also several years of expertise in this department that she handles. So first I would like to, ma'am, if you want, you can speak a few words on menopause. That will be our topic today of discussion. So Dr. Hema will first talk a few words on menopause, and then we can take questions from the audience.
Hello everyone. I don't think I need a mic. Hello. Yeah, so the topic is menopause, and all of our ladies, we all don't like to think about it. We don't like to be there, never. And all those who are nearing there also, they'll just keep postponing it. No, we are not yet there, because people, when we come, including me, when we come and ask, no, not yet. And irregularity of the menstruation, no, it is not menopause. But when we come to the doctor, the first question to the gynecologist, Madam, am I a menopause? Am I going for menopause? Any irregularity after the age of 40, women are worried. Women are totally worried and they just think about menopause because they don't know anything else. They think after 40, any type of bleeding, for that matter, regularly coming excessive bleeding, irregularly coming excessive bleeding, bleeding coming after 3 months, 1 month no bleeding, after coming 2 months after again bleeding. The first question is, am I menopause, madam? I'm so young, I'm only 40, I'm only 42. So we thought, okay, on this Women's Day, we'll explain something about menopause. So menopause is something when you don't have a period for the last 1 year. So we cannot diagnose menopause without a period for 1 month. For 1 year, if you don't have a period, that is menopause. Just keep it or hammer it into your head. Don't worry if you don't have 1 month period, after that 2 months you are getting period, then it is not menopause. So it is a retrospective diagnosis. It is not a diagnosis like, see, when you tell whether the delivery will be normal, for example, whether the delivery will be normal. Delivery is normal after delivering only. Before that you don't know, nobody knows. Nobody can tell. Everything will be going on normal and on the 10th day, on the time of pain, you may end up with a cesarean. So it's like a retrospective. This menopause is also a retrospective diagnosis. Because 1 year, if you don't have periods, yes, it is menopause. That is the definition of menopause. But what happens is, from the age of 40, most of all women, not everybody, most of all, will start getting irregularity or some different patterns in their periods, because the hormones which come to us when we attain menarche is slowly leaving us now. Start to leave us. As it came, it will go, like everything else in life. So once it comes, once you start getting your hormones and all with menarche, you start getting hormonal cycles and all with menarche, and as you reach perimenopause, that is almost at the age of 40, that is you are on the road to the menopause. But it can stay like that for months or years, because the average age of total menopause now is 55. So from 50 to 55, almost all women will end up with a menopause. But from 40, we start walking on to that, we start taking that road to menopause. That is called perimenopause. So these changes is going to affect you, disturb you so much. Depends upon the heredity, family history, so many things are there, but even then, almost all of the women will have to go through these changes in periods before attaining menopause. And the most important thing to remember is, even in menopause or perimenopause, the bleeding should never be heavy or excess. Don't sit thinking that. Excessive bleeding, no, it's okay, menopause will cause, and no, never. Just hammer this also into your mind. After 40, when you are entering the perimenopausal period, it should never be heavy. You have to take a consultation, you have to see the doctor. If the bleeding is going, not one time, repeatedly it is becoming a habit, you have to consult the gynecologist. Because it is not a normal thing, never it will become heavy. Slowly becoming irregular, it will stop. So that is about menopause. There is something called premature menopause. If you stop your period for 1 year, or if it becomes very irregular, only twice a year or 3 times a year, you are getting period before the age of 40. That is premature insufficiency or premature menopause. That is a different topic that we cannot discuss. It has got so many implications. Today it does not include that discussion. So we'll talk something about menopause. Usually, the symptoms of menopause, don't imagine all these symptoms when I'm telling that you all have it. Nobody will get it now. Only then only, because once we tell something, then people all have the idea. It is now, they all have it. So don't, this is just an explanation. These are the symptoms you can get in menopause. One is hot flushes, loss of sleep, loss of interest in sex, then mood swings. Poor husband and children will sit and suffer with us. When we start entering that age, we'll be shouting, we'll be crying, thinking and crying, not thinking and crying, always. These are the things, these are the mood changes which can happen, and these are the symptoms of menopause. So what do you mean by hot flushes? You would have heard so many people telling, you would have heard hot flushes is hot flushes is something. In the middle of the night, we are sleeping very nicely with the AC. You're getting up and you're feeling sudden sweating on upper part of the body and the face. Upper part of the body and the face only. You cannot sleep. It's too much sweating, so much sweating, and after 5 minutes, you are feeling cold. It is getting like you are feeling shivering, you want to put off the AC. So, like in between, everybody will have this, but don't think you are all menopausal now, okay? It is not like that. This happens with the period irregularities. And so what happens? The sleep is disturbed. So when you get up the next day morning, either you cannot go for work properly, or you are upset when your sleep is disturbed. That is what happens with it affects the quality of life, these hot sweats. Usually, like, it is very disturbing. Those who undergo that, we should understand their difficulty. It is very disturbing and it can happen too many times in the night. After one episode, once you start sleeping, it will come back again. So that is very disturbing actually, and that is the main symptom of menopause. So once you get a hot flush, then what happens? You will lack sleep. You won't be able to sleep. Nobody can sleep like this. So this is the main symptom. Then next is mood swings. Mood swings is because of the effect of lack of it, because we are all females because of the power of estrogen. Estrogen is the name of the hormone which is a feminine hormone which keeps always this ladylike and all our women characteristics. Once you start losing that, we will not become somebody else, may not be ourselves. These are the things which are causing the mood swings in menopause. So that is second thing, which affects the quality of life, which affects the family members, which affects the society, which affects the patients we are treating, so many things. So the mood swings are something you have to take care of. So these are all our patterns, and they are all related actually. Then the lack of sexual drive. That is also because of the lack of estrogens. So these are the main symptoms. So what you should do for this? And the thing is, all menopausal women will not feel all these. Only some will have some, and some in like lower and higher proportions. Everybody will be different. They all are not feeling the same thing. So according to your symptoms, you should decide whether you need a treatment, you should consult, or if it is okay, you can manage, there's no need of any treatment. But if it is disturbing you, if it is disturbing the quality of your life, definitely you have to consult the gynecology and get an option. And this is a multidisciplinary treatment. Not only gynecologists can help you. For the mood swings, definitely you need a counseling or a psychotherapy to some extent. And for if it is associated, the treatment, if the patient who is coming to take a treatment is diagnosed with a hypertension or diabetic before, then those specialists also have to be involved. So this is not the only job, not only the job of a gynecologist, this is a multidisciplinary treatment. You should be ready to visit doctors according to your needs. So actually, this in nutshell, and if you, like, becoming old is, we cannot help, but how to age gracefully, how to keep that old age gracefully and be like ourselves till we can. This is something So this is the small advice about menopause. I don't want to go into detail because none of the members sitting here are menopausal age, so you'll get bored. Thank you so much.
Thank you so much, ma'am, for that enlightening speech. We all do need it, even though we are not in that age, but I think everyone, including myself, we have to know what age we have to start considering and how important that part of health is to us. Okay, next, as we are nearing time, we'll move on to a quick session by our general practitioner, Dr. Wala Osman. Can you please come ahead, doctor? She'll just give us a brief about general medical life and women.
Thank you, Dr. Rania. Good morning. Hi, everyone. Happy Women's Day, all of you. I'm Dr. Wala Osman, general practitioner in the Rayan branch. I will talk briefly regarding general women health. Actually, women health is very important because women's is very important. We are a very important part of this community and this society. And the healthy women, that mean healthy children, mean more productive society, this will give a very good impact on the society and better educational society. So women health is a broad category, include issues related to women's itself, like menstrual period problems, pregnancy problems, and some cancers related to especially women's, and also medical disease that affect women's and men's, but it had a really special effect on women's, like heart diseases, diabetes, mental health, UTI, breast cancers, and osteoporosis. All this will give a special impact different ways for women's, not like a men's. So our job is to give awareness to all women's regarding the annual checkup, regarding the visiting of the doctor, regarding we need also to give awareness for women's to at least to be aware of their health, because their health is very important. And again, happy Women's Day to everyone, and thank you so much.
Thank you so much, Dr. Wala. Now, we just have a quick 2-minute brief by Dr. Arifa Hafeez also about general health, and then we'll go on to our questionnaire. Welcome, ma'am.
Hello, good afternoon, everybody, and wish all of you a very happy Women's Day. So I'm a general physician working in Aster Al Hilal. So before we go to the panel discussion, I just want to say, everybody has spoken a lot, very relevant things, but I'll speak from my scope of practice. When we talk as general physicians, we treat the patients as a whole. So we are going for a very holistic approach. We don't take the patient as a system. We'll be looking after the physical, mental, his emotional well-being. So physical health, very, very important for all people, especially for women, because they form the basis of the society. They are a very, very important part of their family, kids, husbands, they all rely on us. So we have to take care of our health to be able to care for other people. So if we talk in physical health, some of the conditions which are specific to women, which we see a lot in our general medicals and OPDs, I think all women, they should go for regular screening checkups, regular screening for any kind of deficiency disorders. Just to keep it brief, like we see a lot of anemias in our OPDs. We see a lot of iron deficiencies, a lot of vitamin deficiencies. Similarly, we see sometimes psychiatric patients, they come to us first because they manifest physically. So there's a lot of migraine headaches, which are not migraines. They are stress-related headaches, tension headaches, a lot of gastric issues, which can have an organic cause. They can have a psychosomatic cause also. Apart from that, I think if any woman, if any history of genetic disorder is there in the family, then it does become imperative for the woman to go for genetic counseling, genetic screening. Then again, regular screening, depending upon the risk factors, depending upon the age for certain cancers, especially breast cancer, cervical cancer. Going for vaccinations wherever it is relevant and wherever it is risk is there. Then some of the endocrine disorders, diabetes, thyroid disorders, they do manifest especially after the age of 40. So anything, anytime we feel is amiss, is different, so we need to go and we need to get ourselves checked. And on top of that, as Dr. Tisha rightly said, we need to manage stress. We don't need to, think that we have to have it all covered. We have to be superwoman. We have to do it everything. We should accept that there are some things we can do, some things others can do better than us. So whatever we can do, we do it to the best of our capability. And wherever we struggle a bit, we go and we ask for help. No harm in that. help from the family, help at workplace, and whatever helps us to manage our stress. Have a good group of friends. You can have a one friend, but a friend to whom you can vent, you can share happiness, sadness issues. Very, very important stress boosting, stress buster. And meditation, music, and as Dr. Tisha said, journaling. If we can journal, well and good. If we can't, just we make a gratitude, 2-3 things. Whenever we are feeling down, we just think what is making us happy, what all God has given us, and what all we deserved and what all we just got from His mercy. So I think being grateful, trying to be happy, and trying to have a positive approach, problem-solving approach to life, I think that is all is going to help us. Thank you so much.
So every one of us striving here to be superwoman. So like Dr. Arifa said, we all don't have to be that superwoman. So here we are ending our talk sessions now. We are open to discussions. We have all our expert panel here, and I would encourage all of you to use this opportunity to ask your doubts, questionnaires, anything that's bothering you in your mind. We have all our doctors together in one panel today, so I think you should all grab this opportunity. So anyone with any questions, we are up. No doubts. Class went very well. No doubts at all. Someone should have some doubt. Yeah. No doubts. Nobody has any question. Yeah, okay, yeah, we have Reena ma'am with a doubt, yes.
Mostly during winter, so maybe Dr. Anila also can comment on this. Sometimes redness and dryness.
Sometimes you experience those symptoms during the start of the winter and it's gradually weaned off by the end of the winter. So it can happen on your face or ears, and mostly patient complains on the ears. There is no specific explanation for that, but that is more of like a dermatological issue. But you don't have to treat it because the treatment is only anti-allergic medication. But if you can manage it without treatment, that is the better option.
Because I try moisturizers, and when it goes to severe state, I try the antihistamines.
You can try moisturizers, and also sometimes when you observe, you can find out the situation that make it worse. Like sometimes people, they complain that when they exposed to, even if it is winter, but when they exposed to heat or while cooking or while exposed to sun, it becomes small. So in that case, you can apply sun protection also. So you have to manage it according to the symptoms. There is no specific treatment for that.
Any other questions? Yes, Sharon.
My mother-in-law, she's facing sleeplessness and blood pressure also variation. And he has some uterus, its elasticity, it's gone. So whether she had to take any treatment like And one more thing, can you put some lights on supplements which are on these women have to take, or whether it's necessary, like in some cases, even if in our pharmacy some patients are asking, even though they are not testing for any deficiency or not, they are asking whether can I take this one regularly or like that. So no, I'm just asking for women whether we need to take supplements. It's
calcium, vitamin D, daily supplements are helpful supplements, but that is not going to prevent osteoporosis. It is not. Calcium and like once the menopause sets in, even who's taking calcium and vitamin D can go into osteoporosis. So like that is, but in younger age group, definitely when you are like having a menstruation, lactating, urine, definitely calcium vitamin D and all that. But menopause, calcium and vitamin D alone may not be sufficient. That we should take care in another way. But for the people coming and asking, to tell you that it's no problem. But vitamin, like fat soluble vitamins, be careful when you are talking like that to patients. Because fat soluble, if they get accumulated, we get problems. Water soluble vitamins, okay. Yeah. See, vitamin A and all, we want to take it so much, is very bad. We also. So that we should have that.
Thank you.
Anybody else in the audience who has any queries? Yeah, we have Anjali.
Thank you. First of all, thank you, all of you, all the doctors, for such a session. My question is something which I'm struggling at present. We often say that pigmentation comes during pregnancy. So I want to know, like, is there any, the reason is deficiency of something, so why not we are telling, to the patient at the time of, is it, we can take the medicines during pregnancy to avoid it, if it's something related to the deficiency, and what is the cure? How much I tried to find out the solution, consulting the doctors, like, it is very slow and, the solution is not immediate and I have maybe a lot of processes required. So something on that.
There are some pigmentation that happens in pregnancy are normal, and that usually start to fade after pregnancy. But most of the time, like pigmentations like melasma, it starts. Sometimes it comes and then it gets faded after pregnancy, but it can sometimes even worse after pregnancy. And there are a lot of factors which influence melasma, but I would like to say the first one is genetic. So that is why it's not happening to all women. And second one is hormonal changes. Normal hormonal changes can also result in melasma. In that case, you cannot do any treatment. I mean, you cannot be more cautious because that is how normal hormonal changes that everybody has to go through. But sometimes hormone replacement therapies or external hormonal treatments can increase the problem. In that case, you can avoid that, but depending on your clinical condition. And another thing is sunlight. Even though we are not exposed to direct sunlight, even the light from the system and the lights from the tubes that we are almost all the time in front of the screen, that can increase the pigmentation. And the third one is genetic, hormonal, and also ethnicity and the environmental factors. Sometimes you might have that genetic factor, but it is not coming out when you are at a particular place. But if you come and stay in another place, there are a lot of known and unknown factors which can influence the pigmentation. And when you ask about the pigmentation in pregnancy, most of the pigmentation will go after pregnancy. But the one which usually say is actually melasma. But melasma is not only due to pregnancy, like even without pregnant women also can develop melasma after their 30 or 40, depending on your genetic. But other things that you have to customize the treatment depending on the depth of the pigmentation, type of melasma, extent. You have to combine a lot of treatment to get an adequate result.
Anybody else with any queries for our doctors?
What lifestyle changes can be made to improve the heart health?
Heart health. I think that will be for Dr. Arifa or Dr. Bala.
Yeah. First degree relative, so we have to be extra cautious. We have to be cautious. We have to screen ourselves for a routine heart health screening. Secondly, diet, because we are what we eat. So heart healthy food. Heart healthy food is anything that is not rich in refined carbohydrates, that is not rich in saturated fats and oils, and that has a lot of fiber, that is a lot of fruit, water the solution for everything. And then any amount of, depending upon the profession we are in, our work life, we have to incorporate minimum 30 to 45 minutes of exercise at least 6 days per week. And so if all these measures, and then of course, maintain other conditions, because it is interrelated. Sometimes if a person has diabetes, weight issues are there, any other hormonal issues are there, there is an increased risk of heart diseases. And again, then managing stress, then avoiding any addicting habits, smoking, alcoholism, and then being active, being physically active, eating well, sleeping well, and getting exercise. I think so.
If there are no more queries, we can wind up. If there is anything else you have, ma'am, Dr. Ketaki? Anything? Anybody else? We can take one more question. We do have time. Okay. I think all the questions are over. So I would love to thank everyone for attending this session and making it a huge success, especially to our online viewers too, and to those who are physically present here. It was a lovely session. We all had great fun and also had a lot of advices from our expert panel telling us how to move on ahead as better women. So, but for conclusion, we have a small token of appreciation for our doctors in the expert panel. I would like to call Dr. Ketaki to present the token of appreciation to Dr. Tisha, please. Ma'am. Thank you. Next, I would like to call Dr. Renuka to present the token of appreciation to Dr. Anila. Thank you. Next, I would like to call Ms. Reena ma'am to present the token to Dr. Jean. Next, also one more token of gratitude for Dr. Hema, Ma'am Reena itself. Thank you so much. Next, I would like to call Manal for Dr. Arifa. Can we have an applause? Next, I would like to call dear Anjali to present the token to Dr. Bala. Thank you so much for each one of you who has participated. So I think we will wind up. Manal has something to say.
Yeah, so before we end the session, we have to thank our moderator for the day, Dr. Rania, and we have a little something for you as a token of appreciation for you as well. In front. Thank you so much, Dr. Rania, for hosting it. Thank you all doctors for coming. It was a wonderful session. I'm sure all the females here and online, they all benefited. Thank you so much. And thank you.